Hey everyone, it's Lisa Moeller with Medmark Media and Dental Sleep Practice Magazine, and we are live today at Dentsply Sirona World 2017. And we are talking dental sleep today with two of the experts in our field, the lovely Dr. Erin Elliott, all the way from Idaho, and also lovely.
I was going to say, because if I didn't get a lovely, I was going to be a little disappointed.
The very distinguished Tarun Agarwal.
You know, they put makeup on me today.
I know. Yeah. You look amazing.
Thank you.
I told you, 10 years younger.
At least. At least.
Thanks so much for joining us today, you guys.
Thanks for having us, Lisa. It's awesome.
We're going to talk about a topic that's near and dear, obviously, to my heart, and that's dental sleep. I'm going to do a little plug for Dental Sleep Magazine, Dental Sleep Practice Magazine here, and you'll recognize our cover girl, beautiful Dr. Erin Elliott.
Ooh, centerfold.
Got to do a little shameless plug for Dental Sleep Practice. So, you guys, tell me, you guys are leaders in the field of dental sleep. Tell me why it's so important to you to be able to treat sleep apnea and why that's so near and dear to your heart.
Well, you know, I think ultimately everything's always about a connection or a story. You know, we all know someone that suffers from something, and the truth is, the statistics will tell you that there's roughly about 25 million people that suffer from sleep apnea, but I would like to think that that number is incorrect, because every time someone suffers from sleep apnea, it affects their bed partner. So the number is probably really double, to be quite honest with you.
Right.
And for me, sleep apnea is very personal, because I am a sleep apneic. I was diagnosed as a sleep apneic. It was getting so bad that people wouldn't stay in the same room with me. It was and when we're young, it doesn't affect our bodies the same as when we're older, in the sense that when we're young, we overcome some of the symptoms of sleep apnea, but as we age, some of these symptoms start catching up to us, and we think of it as, just normal process of aging. But the truth is, as a 40-year-old man, I shouldn't be tired throughout the day. I should feel refreshed in the day. It's some of those things. And the truth is our medical community isn't doing as justice that sleep apnea deserves, because it's a very big condition that just isn't getting talked about in the medical offices.
Right. And the symptoms they range from heart issues to kidney issues to liver issues to breathing problems. I mean, you're right, people just think they're aging and all of a sudden,
they chalk it up to, I have young kids, I'm running, a business, whatever it may be. But and thanks for rubbing it in that we're aging, by the way. But I think so many patients are in denial, and they'll go to their physician and say, I'm feeling a little run down. So they check their thyroid, or they do blood work. Or if a young person or a female says, I have insomnia, and they give them sleeping pills. They're not really asking the question of, well, how do you sleep and why do you not sleep well?
Right.
And so dentists, of course, we really are on the front line. We stare at airways all day long.
Right.
Better positioned to be screening and talking to our patients about it than us.
And it's so important also for children, like you mentioned, because they're diagnosing with attention deficit disorder, and these kids actually have sleep apnea. They're just not getting sleep and properly treated, right?
Can I ask you a question, Lisa? Before you said that this sleep apnea is obviously near and dear to my heart, what is your story?
Oh, Erin, I have sleep apnea myself, and that's why I started dental sleep practice over 3 years ago. And my husband has the same story as probably your wife. When one person suffers from it, the spouse does too.
Right, exactly.
There's no sleep happening.
The kids.
Exactly. And I went from doctor to doctor trying to figure out what was wrong with me for probably, 4 or 5 years I was diagnosed of all things from my chiropractor. And I went in for an adjustment, and he's like, I'm not going to adjust you. You have sleep apnea. You filled out the 10-question questionnaire. Right. He's like, you have sleep apnea. I can tell just by looking at you and by what you filled out on my intake form. And I went and got tested, and I had it.
They ask about the whole body.
Right.
Really.
Right.
Your lifestyle.
Which is amazing.
Go ahead.
I was going to say, and dentists, these days we see a dentist every, 3 to 6 months. So we're seeing you guys a lot, and you're in our airways, you're in our mouths, and I just think that for me, it just became a mission to spread the word and get it out there.
It's my mission too.
Right?
It's interesting. You said something very key there. And coming from a family of physicians, it's amazing to me how many physicians you saw, and none of them really talked to you about the relationship, not necessarily cause and effect relationship, but the relationship, the co-condition between sleep apnea and many of the other things that you're dealing with.
Right.
And to me, that's what I hear over and over and over again from dental professionals, not from the perspective of treating their own patients, but from themselves. As they're suffering from these things and they're taught that these things are normal, or they're led to believe that it's normal to feel this way, but it's not.
No,
and,
it's not.
And as Erin mentioned, the truth is how often does any medical professional spend 45 minutes or an hour with you? They don't. But in the dental practice, our hygienists are spending 45 minutes to an hour with our patients, and they're looking in their mouth, they're seeing the signs and symptoms, and they're able to, not diagnose, but we're able to do that first line of screening to help our patients get diagnosed.
Right, which is so important. So share with our audience your best practices for treating sleep apnea.
So I'll let Erin start there. Ladies first.
Yeah. What's interesting is I've been meeting a lot of new people, a lot of dentists at this meeting. And as soon as they say, or I tell them that I'm going to be speaking on sleep apnea, they're like, oh yeah, I probably have that. I snore, I should probably do something about it. And I'm like, why haven't you? And it comes down to, when I ask them that question, is convenience, some denial of, well, I'm too young to really have this old fat person's disease, which it has a bad rap for. And so I think with our best practices is educating the patient, obviously. And when we teach together, we talk a lot about creating awareness. And so that's kind of, I think, our best practice is talking to our patients, creating an awareness, having them take ownership that maybe there is a problem. But the second part of that is the convenience part, is if the patients have an uphill battle to have to go to doctor, or go spend the night somewhere where they don't want to go in the first place to get a treatment they never wanted in the second place.
Right.
Really just removing hurdles and making it easy for our patients to get the help they need.
I think one of the things that I would say is best practices is oftentimes people think of sleep apnea as in they have to go all the way, they got to treat and everything. And I think, to me, best practice starts with just screening. Okay, so to me, I think we need to make it standard of care in dental practices that we start asking some basic questions of our patients in their health history form. Things like, do you snore? Have you had a sleep test? Do you feel rested and refreshed in the morning time? If we can just start the conversations in a subliminal, non-aggressive way with our patients and start that conversation there, it's amazing what we can find out. And to me, the other thing that I often think is lost in the whole sleep apnea thing, one of the challenges as a dental practitioners we have is facing extreme competition. Okay, I know the buzzword is nobody's your competition, but at the end of the day, we're all fighting for a number of patients in the market, right?
Right.
So what we want is we want our patients to love us and trust us and to be committed to us, right? But I have found that when you can help a patient get therapy for something that they didn't know what was causing and that can dramatically change their life, they're a patient for life in your practice. They begin to trust you, they trust you implicitly, they refer friends. It's unbelievable what's possible there. So I would think best practice first and foremost is always awareness. It starts to me at the front office with the forms and the questions. It then continues with the hygienist doing an oral exam, looking for a few key things, in what we can look at in our patients. And then from there, it continues in becoming a patient advocate to helping them down the path of whatever the best treatment is for them. Not every patient is a candidate for an oral appliance, and not every patient is a candidate for a CPAP.
Right.
So to me, best practice starts with awareness.
Is what's best for the patient, but just asking them and to piggyback off some of those questions to add to your health history. When he said, "Do you snore?" I also put, has anyone ever told you that you snore? Because
I don't think I snore, by the way.
Right, yes.
I didn't snore either, but obviously I have video that I of something otherwise. Or have you had a sleep study or been told to get one? So some of those follow-up questions really kind of dial it in for patients, and then adding things like insomnia, trouble sleeping. Do they take melatonin, which is over the counter? Are they going to tell you that? Are they on diabetes medications? Are they, on 3 different high blood pressure medications? They're telling it. They're giving us the clues. We just need to connect the
We're
dots.
not connecting the dots.
Just
You're exactly
ask.
right.
Just ask and have the dialogue.
Yep.
Mine was I kept waking up thinking, oh, I'm having that dream again where someo's choking me.
Oh, there's a sign.
And I would wake up and I was choking, gasping for air because I couldn't breathe. So
one of the
so frustrating.
It's funny you say that. One of the things I hear very commonly from my patients is that I'm asking them is, how many times per night do you go to the bathroom?
Yeah.
And I think it's abnormal for a person to go to the bathroom 2 or 3 times per night.
Yes.
And some people, again, back to that, we're aging.
It's denial, yeah. Or I have a bad prostate, or I drink too much water, or my dog woke me
There's
up.
always an excuse.
Yep.
Yeah. You never want to think, oh my gosh, I have this condition, that I have to treat, and we're all busy. And how scary for someone to be diagnosed. I know when I was diagnosed, the first line, they're always throwing the CPAP at you. They're always turning you into Darth Vader, and 50% of people, that use the CPAP are non-compliant.
That brings up a good point of effectiveness.
Right.
I think one of the challenges dentists face is that the medical community, and listen, my wife's a physician, my family's physicians, I'm not anti-physician in any way, shape, or form, but one of the challenges that we're faced is that as dentists, we're often relegated that we should never touch a CPAP first. And that's not necessarily true.
Right.
And to me, or dentists will tell me, well, it's not, oral appliances aren't effective. And I'll always say, well, define effectiveness for me. Is effectiveness the CPAP that sits in the corner, like Judge Antonin Scalia, like you talked about today? Is a CPAP something that by the way, effectiveness for a CPAP is only wearing it at least 4 hours per night. That's considered effectiveness.
Right.
But yet it's recommended that you get 8 hours per night of sleep. I don't understand
so how does that work?
On the other point, we as dentists can't think that every patient can be treated with an appliance either. So just like he said, we're not anti-CPAP, but it's only effective if you're wearing it.
Depending on the AHI and how bad a case is and that type of thing.
And but it's interesting you point out AHI. See, AHI is just a number, right? But the number is so much more. Is it all hypopneas? Is it apneas? How long are the apneas? Are there cardiac issues associated with it? There's so much, to me, one of the things that was eye-opening for me, being relatively new in the sleep field for the last 3-4 years, is that when I first started, it was the number is 5 to 15, then don't treat. But then I'm like, well, 20s sometimes are all hypopneas and they're not apneas. In fact, you don't have to stop breathing to have obstructive sleep apnea. You can just have desaturations, and then you have obstructive sleep apnea.
And what's interesting? The guy that invented AHI regrets it. He says that to this day, and unfortunately, medical insurance has grabbed a hold of that. But that excludes the people that are suffering with upper airway resistance syndrome. That is causing tremendous fatigue. It's that the sleepy snore, or the people that are pre-apnics, but it's affecting their life in a big way, and medical insurance doesn't care. And so he wishes he could take it back.
Oh, wow.
Because it just
I didn't know that.
Puts us in this box.
Right, yeah. So tell us about your work with 3D dentists. Both of you are doing such amazing work with that. Let's hear about that.
So, I started 3D Dentists about 4 years ago as a training venue to really kind of share with other dentists what it is we're doing in our practice. Again, everybody's looking for an edge. Everybody wants to grow. Well, not everybody, but most people want to grow and they want to do something different. And really what I try to do is I tell people that ultimately we're after 3 things. We're looking to make more money, we're looking to buy more time, or we're looking to create more satisfaction. And really, to me, the challenge is that my crusade, in a sense, is I want dentists to understand that we don't have to just do fillings and crowns. There's so much more that we can do, and sleep apnea represents probably one of the only things that we can do that is life-changing, practice-changing, patient-changing, team-changing. And the challenge I was having when I first started doing sleep was that it was unbelievably scientific in education. Really, everybody talked about the science behind it, and that's important to learn. But then the science doesn't translate into the busy PPO practice that has 2 or 3 hygienists, that has multiple patients coming through, that wants to manage referrals with ENTs and sleep physicians, and where do I get diagnosed? Can I diagnose? Can I not diagnose? And so to me, what I've always been good at, and what I've always strived to be, is trying to bring a logical workflow that works in the everyday practice, not the boutique practice, not the high volume practice, but the traditional 80% practice.
Right.
And so when I met Erin, online by the way, how you meet everybody these days.
Of course.
Yeah.
But otherwise, if she had met me in person, she probably wouldn't have liked me. So I had to get her to like me
I don't
online.
know about that.
So I knew she was the right fit for what we were trying to do for me personally, and then to lead our sleep program has been fantastic.
Well, there's so many moving parts, from start to finish, from when a patient is diagnosed and the insurance and everything. I mean,
And that's why being paired up with T-Bone, there's so many courses out there that you learn a lot of the head knowledge, but then you don't know what to do with it. Or there's courses where they're trying to sell you something, right? And so when I paired up with him, we got to just teach. And that was just so freeing.
do the fun stuff.
And in a practical manner. And that's why I love your publication as well, because you have such a mix of practicality as well as the science and all of that. That's why we're a good team. I think that, the workflow is such a focus for us. And then, of course, the foundation of science and how to treat patients. But the teams go home with a game plan for Monday morning. And I've run into a ton of our previous, attendees, and they're doing good. But it's a slow brew. It's a little bit of a marathon, not a sprint. You're not going to come back and do 100 appliances the next week.
Right.
But getting the systems in place, figuring out medical insurance, we give you all the tools to be able to do that. And that's why that's why I fly from Idaho to Raleigh, however many
Raleigh
times
was
a year.
budding metropolis.
Yeah, I don't know. I haven't
hurt
seen
my
Raleigh.
feelings
I
like
see
that.
your office and your house.
It's T-Bone's sparkling personality.
Exactly. Well, I don't know. So I want to piggyback, if you don't mind, Lisa, on one thing that she said. I think to me what really separates what we do are a couple of things. Okay. One is neither one of us have a sleep practice. We both have general practices where sleep is a component of what we do.
Right.
Okay, so that translates into reality for most people out there. Okay, because very few people are going to be able to, or want to develop a practice where all they do is sleep.
Right.
Okay? And I think the second thing that ultimately I saw, so look, I started treating sleep 5 years ago, and then I stopped. And then I picked back up. And the big difference was 5 years ago, I went to the class and learned the science and then implemented it at that level. And then 2 or 3 years ago, I brought the team on board and we started bringing our front office, our assistant, our hygienist, and we started making a team approach to sleep apnea.
Right.
And that's what our course is really
That's
about.
the most important key to success.
That's so important for you guys to be teaching the dentists about what you do and how to have a successful sleep practice. Because again, there are so many details and so much to consider. I think that a lot of them get really overwhelmed.
But it can be overwhelmed.
Yeah.
Listen, as soon as you say medical insurance, it's very easy to get overwhelmed.
Yes.
Okay, but we got to break it down into chunk pieces. I think you've got to break it down and say, you know what, my front office person is in charge of the medical insurance portion of this. My back office person is in charge of the treatment portion of this. My hygienist is in charge of the awareness portion of this. So what we try to teach is a 4-step process. Step 1 is creating awareness. It starts in the front. It's really controlled by the hygienist because they're the ones spending the most amount of time with your patients, especially your new patients. And then it runs into getting a diagnosis, which is about working with your physician community, because as dentists, we cannot diagnose sleep apnea.
Right.
Okay, so we need to work with our physicians. And then it works with our front office doing the medical insurance and the financial arrangements to help our patients pay for the therapy. And then it goes into treatment where our assistant takes it.
And notice what the last step is. That's his joke all the time, is we get asked all the time, what's your favorite appliance? Well, guess what? It doesn't matter if you don't have a patient to put it in. And so that's dentists, as a general rule, focus so much on the technical part of stuff, but forget about the human part of it in the flow in the systems.
Right.
And so we want to get more patients to get more help. And if it's hard, dentists will give up.
And it's all about the team, right?
It is all about the team.
With any business, I say teamwork makes the dream work.
Yeah.
Yep.
I mean, it's just, I wouldn't be able to do what I do with 4 magazines without my amazing team.
Right.
So.
It's interesting. When we talk to dentists, the number one complaint they have all the time is always going to be, how do you retain good team members? How do you motivate team members? And I'll say, you know what? The problem is what have you made new for your team members in the last 5 years? Your team members are doing the same things they've always done. And you need to bring something new for them, something that they can own, something that they can build, and something. So when we did Liz in this position in our practice, I've seen her flourish. I've seen her connect with patients. I've seen her get the stories. I've seen her work with our team members to make this happen. It's become her why. It's become her driving force in what she does. And I think, she's a team member for life in that sense, because it's awesome.
Well, if they can see your patients getting better too.
Yeah.
I mean, how cool is that when your patients come in and say, I'm dreaming again?
Yes.
I mean, isn't that a huge deal?
And I've been told by a lot of dentists this weekend, I think I better go get trained. I've been doing it wrong. I just give my patients a snore guard. And if there is one message I can give, is stop doing snore guards, because what that tells me is the patient was not tested. You basically thought it was like making a mouth guard for this patient, and it's so much more than that.
Right.
Speaking of mouth guards, we've implemented a new thing in our practice now where hey, you know how famous we are, Erin? We had the Samir Puri walk behind us to do a photo bomb.
Because he knew everyone was watching.
Of course.
That was awesome.
So we've implemented a new standard of care in our practice where we won't make a mouth guard until we do a sleep test. Because what do we make mouth guards for? Bruxism. And what is one of the most common co-conditions with sleep apneics? Bruxism.
Right.
So why in the world would you make a mouth guard that may put the patient's jaw backwards, that may open them not enough, or too little bit, or not move them forward, crowd the tongue? So we want to start doing sleep testing for our mouth guard patients to make sure we get them in the right type of mouth guard.
Absolutely, that's so important. Because if they use the wrong type, then they think if they can't wear it or it's uncomfortable, they think it's a failure, and then they're not going to what they should be wearing in the first place. So,
or they're masking a more serious condition.
Right.
Which is a problem.
Right, absolutely. So tell us about your infamous podcast, T-Bone Speaks. Let's hear about this, because it's pretty entertaining. I've seen a couple of things on Facebook.
Well, again, for me, my number one goal is to make an impact. I want to help people. I love dentistry. I'm passionate about it. It's in my blood to a certain degree.
He uses the word help, but I would use the word challenge.
In
a good way.
Yeah,
in a good way. Push us
to
be better.
Absolutely.
And I think
that's good.
Sometimes I get uncomfortable because I know I could be doing more, and he pushes.
It's about pushing the right buttons.
Yeah.
Some people take it the wrong way, and that's okay. But so for me, one of the challenges I was facing was you can't reach as many people by traveling all over the place. There's only so much time. People don't want to get around and all of that stuff. So to me,
I see you in like a T-Bone Speaks bus. I see you in like a rock star bus traveling.
Well, but you can only reach so many people that way,
True.
right? So to me, the medium of today is about being able to reach people while they're working out, while they're driving in the car, and that's what the podcast is. It's a way to express our thoughts, and I think to me, what I'm most proud of is the feedback I get in that it's real, it's practical, it's the challenges that they're facing. I try to bring on regular dentists, quote unquote regular dentists, that are facing the same challenges we face every single day. And to me, podcasts, they're free. They're on our phone. Who doesn't carry a smartphone? And honestly, we don't need to be listening to music anymore.
I download a whole bunch just before my flight. I have to turn the airplane mode on, and that's what I listen to when I work out. I'm a true dental nerd.
And worms.
It's a great.
I love that one.
Little Justin Moody plug.
Yeah, absolutely. And Justin's fantastic. But
he is.
It's a way to connect with people, and reach them in a different
And get
way.
them excited about dentistry. I just see so much, I don't know, lack of passion or burnout, whatever the word may be, but we are blessed with this career, and we can do what we want in dentistry, so why not make it good?
You know, my dad always told me growing up, because my dad was a dentist in India, never practiced in the U.S., he always said you should consider dentistry. I'm like, why? He goes, because it is a profession where you control your destiny. You're as successful as you want to be. You do the types of procedures you want to do. And I've always taken that to heart. And so I want to love what I do. And when I go to the office and do something I don't like, I'm like, why am I doing that? You know, and I get we got to make money. We got to do, you know, we got to put food on the table. But to me, it's a win-win-win. The patients win, our practice wins, and you feel, when you hear the stories of your patients getting back together in the bedroom together.
I don't want to hear about those stories.
I'm not talking about hearing about the details.
A PG-13 show.
Well, with me, it's never that way. Okay? But, you know, but the connection, the medications, you know, the co-conditions, high blood pressure, diabetes, and sleep apnea is not a obese disease.
Nope.
No.
Not at all.
That's
they
a
don't need
horrible
to look like me to
misconception.
have sleep apnea.
My favorite part when we do the home sleep studies at our course is these are dentists and team members that come to the course, and they're
educated
healthcare-
professionals.
educated people, and when we test them, and more than half have sleep apnea, and they're even young, fit guys that say, you know, I just have young kids and I run a practice. That's why I'm tired.
Absolutely.
It blows their mind, and that's always my favorite part is the big reveal.
Oh, I love that. Thank you guys so much for joining us
thank
today.
you,
You're
Lisa.
doing such important work in dental sleep, and
Thank you, Lisa, for having the publication.
Thank you.
To spread the word. That's what we need.
oh, it's really very near and dear to my heart, like I said in the beginning. And if anyone wants more information on dental sleep practice, they can go to dentalsleeppractice.com.
It's a
and
great
for more
publication.
information, would you like to give your website?
Yeah, absolutely. It's tbonespeaks.com or 3d-dentist.com.
Okay, and Erin? You're good.
3D-dentist.com.
Good, okay. Thanks so much, you guys.
Thank you, Lisa.
We'll see you soon.
Thank you, Erin.
Okay, take care.